idiopathic pulmonary fibrosis. And idiopathic is unknown cause or spontaneous occurrence. So it is a condition that truly is felt to be more of a spontaneous occurring type of condition. It's a chronic, progressive lung disease, and it results in fibrosis. And fibrosis is a scarring type of condition that occurs mainly in adults. This is an adult condition, and it is limited to the lungs. And so over time, as the fibrosis gets worse, it becomes harder to take a deep breath because the fibrosis causes a restriction in the lungs, reduces the capacity, and then eventually the lungs are not able to take in enough oxygen. The two most common symptoms are shortness of breath with activity. So not so much shortness of breath at rest, but shortness of breath with activity and dry cough. In the earliest symptoms, it's about 80% of the cases will present with dry cough. These symptoms usually occurs very subtly and very slow in terms of the onset. It can occur very gradually over several months, sometimes to several years. In the more advanced stages, people will become fatigued, loss of weight, sometimes with muscle and joint types of symptoms. Pains and that very subtly, can be associated with it. So those, I would say, are probably the main symptoms. But the shortness of breath, usually it's with exertion when it first starts. Once it becomes very advanced and becomes very more serious, then people start to have trouble even when they're resting or when they're talking. And then we know that now it's become much more advanced. And there really is not a specific cause that has been determined, but the researchers, have looked at a number of factors, and some of these factors include gene mutations, and they've been able to identify, some specific genes, mutations that can occur that result in this fibrosis. And in fact, these gene mutations can be linked to families, and about 20% of patients that have idiopathic fibrosis have the form called familial, where they have one or more family members that have a fibrosis lung disease. Tobacco smoke is felt to be a very major factor. Either former or current cigarette smokers are at a high risk. Environmental exposures to certain metal, woods, and dust is felt to be a factor. Even the digestive acid in the stomach and people that have acid reflux is felt to have some type of involvement. And then certain viruses, like herpes and Epstein-Barr viruses, have been linked to the process of the fibrosis in idiopathic pulmonary fibrosis. Older age, family history, genetics, and cigarette smoking, I think are kind of the major, risk factors. Even as of now, 2020, even with a lot of the research that's going on, it still it cannot be cured. It can be treated. And the process of the fibrosis can be slowed down, by treatment. But in terms of eliminating it, as we would some condition like an infection, pneumonia, no, it cannot be cured at this time. There has been two FDA or established pharmacologic medications that have an anti-fibrotic effect. So they try to stop or inhibit the fibrosis process. And so patients that have acid reflux, we do also treat with antacid type of medications. People that have very advanced or what we call end stage generally will not benefit from these medications. The idea of these medications is to slow down the progression. So it has to be given, kind of at a earlier and less severe, stage. Once it becomes more advanced, although they can be tried, they generally are not as effective. And in fact, the risk of the side effects can become more than the benefit at that point. Sometimes ventilator to help ventilate and sometimes can be given in a home situation. Pulmonary rehabilitation has not been studied as well, but it has been looked at in some clinical trials. The benefit of pulmonary rehabilitation in people that have IPF and lung diseases is primarily in the shortness of breath. So that the idea is that the therapy that's given, the exercise therapy, will not affect the fibrosis process, but it can somehow improve the patient's symptom of dyspnea that will allow them to carry on their activities of daily living, and in some cases maybe do more. They can improve their exercise capacity. But again, there are a number of patients that will not benefit through it. But it is something that is offered. And the diagnosis of IPF involves generally five steps. First and foremost, the history and physical examination. I think that it's probably one of the most important, and I consider it the first step. On the physical examination, in the lungs, when the doctor is listening, they will hear a crackling noise when they listen with their stethoscope. And this crackling noise can be, if you know the sound of sandpaper rubbing or Velcro, sound of Velcro sound, that is what the cracklings of pulmonary fibrosis and idiopathic pulmonary can sound like, and that's what we listen for. The second is the pulmonary function test. The pulmonary function testing is usually by a device called a spirometer, in which a person will inhale and exhale into this device, and we're able to measure the lung capacity and also the ability of oxygen to be transferred from the small alveoli into the circulation. And so we're able to make these measurements, and this gives us an idea of how their lung is functioning. One of the other important parts of the pulmonary function test is a test that we can do generally in the office called the 6-minute walk test. And this 6-minute walk test is somewhat of a simplified way of measuring the person's exercise capacity as well as ability to maintain their oxygen level. And it is a test where we have the patient walk at their usual pace for 6 minutes without stopping. And so we're able to measure how far they're able to cover in those 6 minutes to determine their capacity, and also whether their oxygen level will go down or not when they do that 6-minute walk. So that information is very important in terms of determining how much the idiopathic pulmonary fibrosis is affecting a person's lung function. Laboratory blood tests are a supportive of the diagnosis. There are not any particular blood tests that can actually definitively diagnose it, but the laboratory blood tests are an important step. High-resolution CAT scan is probably by many considered now to be kind of the gold standard in terms of definitively diagnosing this condition, IPF. We can image, give a 360-degree, three-dimensional image of the inside of the chest cavity, and the high-resolution CAT scan can show very, very specific changes of fibrosis and patterns of fibrosis that are very characteristic to idiopathic pulmonary fibrosis. And it's taken years for the experts and people radiologists that can make these readings and then can tell the patient that you have idiopathic pulmonary fibrosis on the basis of the pattern and what we see on the high-resolution CAT scan. The other step also is sampling of the tissue, the lung tissue, either in the form of what's called bronchoscopy, where a camera is inserted under an anesthetized patient and small biopsies are taken through a fiber optic scope bronchoscopy. And then a more direct is by a surgical. And so in surgical, and these are more the invasive types of testing and evaluating and coming up with a diagnosis of idiopathic pulmonary fibrosis. And of course, the two main symptoms, shortness of breath with activity and cough, are those would be initial clues to lead us into the diagnosis of idiopathic pulmonary fibrosis. although the diagnosis can be made by an individual doctor such as the pulmonologist, a lot of times the pulmonologist will look to a team approach in making the diagnosis of idiopathic pulmonary fibrosis. With regards to the living, I guess, with in the coronavirus pandemic, I think the most important thing that patients with idiopathic pulmonary fibrosis really need to keep in mind is that their condition puts them at one of the highest risks for not only developing the coronavirus infection, but also dying from it. That is the message that needs to go out. And I don't send that as a message to people with IPF of fear, but of awareness. They are extremely high risk. Their lung immune system is very weak. And so continuing the self-isolation at home, until authorities can really give this a go. Also, the distancing, beyond 6 feet. Now, in the household, that can be not as practical, but as much as possible, keeping the distance. And also, we underestimate, but hand washing, the hand washing with regular soap and very thorough hand washing, very important. And again, I'm speaking specifically to the patients with IPF because, again, they are at the highest risk. So they have to take the precautions much more than others that don't. The cleaning of your surfaces at home with a cleaning solution, proper cleaning solution. So a bleach solution, or if it's going to be an alcohol-based solution, that it should be greater than 60% based, alcohol solution in terms of cleaning off common things that you hold on to, your phones, the doorknobs, the surfaces and so forth. And again, I know this takes a lot of work, but it really can make a difference because right now, as you know, there is no treatment, there is no vaccination. We're remaining hopeful that will come, but we really have to rely on preventing the transmission. And these are the kind of the important things to do. And so I think that if patients have to, they're forced, they have to go out of the household, then I do feel like others that face masking of some sort, especially our high-risk patients, I think would be important and, would be recommended.